Dan Pizzagna, I'm the Executive Director of the John Dow Foundation. Standing here in a place called Poktap. Poktap, as you can see behind me, is a refugee camp. It's also the location of the new John Dow Foundation medical facility. From this facility, we're providing maternity services, providing nutrition services. We have a full working lab, and we're doing the best we can, even in this difficult situation.
In December of 2013, violent conflict broke out in South Sudan. By March of 2014, violence had spread through the entire country, displacing millions and bringing South Sudan to the brink of famine. Duk County, base of operation for the John Dow Foundation, was especially hard hit by this conflict. Much of the population of Duk County fled seeking safe haven. By November 2014, people began returning to Duk, first settling in the village of Poktap. The existing medical clinic in Poktap had been destroyed in the conflict, and there were no functioning medical services. JDF realized that this population was in need and quickly established medical operations in the community. By January of 2015, JDF had a working medical facility and began providing care to patients. Word got around that JDF was providing care in Poktap, and the population began to grow. In November of 2014, the estimated population of Poktap was 7,500. By February of 2015, the population had grown to 15,000. Today, the population continues to grow. Many new refugees arriving in Poktap are from communities which have been cut off from all medical services due to conflict. These people who have not had access to medical care for over a year are much more likely to be suffering from disease and severe malnutrition. A core principle of the John Dow Foundation is that we provide care to all vulnerable people in need, regardless of tribal or political affiliation. In our effort to abide by this principle, JDF has been expanding medical services to provide additional care to the population of Poktap. We are now providing a range of services, including inpatient care, primary care, maternity, laboratory, and nutrition services. In particular, there is a high demand for nutrition and maternity services in Poktap. In our nutrition program, we reach out to the community to identify children under 5 years old. These children are then screened for severe malnutrition. If we find these children at risk at starving, we admit them into our nutrition program and feed them a nutrient-rich supplement until they achieve a healthy weight.
Good boy, yeah, you can laugh.
In our humble but fully functional maternity facility, we educate new and expecting mothers, conduct pre- and postnatal consultations, and keep a full-time midwife on staff to facilitate deliveries. This site also has a battery-powered ultrasound, which we use to identify the position of the infant before the birth so we can avoid complications. Poktap lacks permanent infrastructure and has few latrines, making it a difficult environment to operate in. Further complicating the situation is that the coming onset of the wet season will soon mean the majority of the location is underwater. Despite this adversity, JDF is working hard every day to provide care to this population which is truly in need. Thus far, our accomplishments have been truly inspiring. With the support of our generous partners and donors, JDF is making a real impact in this community which has been devastated by conflict and is in need of medical care.
On behalf of the John Dow Foundation, thank you for your support.